Hi everyone, my name is Sister Ella, aka Jesus Baby. Welcome to my YouTube channel once again, and I'm here to talk on dangers of taking unprescribed medication. And this teaching are targeted for some people who are regular abuser of these drugs, and with some people with special cases. So, what is drugs? It is a medicine or substance which has physiological effect when ingested and otherwise introduced into the body. So, any drugs you take as an individual has a physiological effect. And what is drug abuse? It is the use of drug in amount or by method which are harmful to individuals or others. So drug abuse is an amount, method which is harmful. It is never, it is never for your advantage in your body. It is always harmful. Now, who I'm going to pick some specific condition: hypertension, diabetes mellitus, bacterial infection, painkiller, malaria. I chose this specific topic because this is one of the most commonest condition one encounters regularly in his or her, medical practice. And for those that have hypertension, they usually, go on hypertensive. Those on diabetes mellitus, they usually have them, give them Dianel or glucophage. In the worst scenario, last resort, they usually give them insulin after placing them on diet and all the rest of them. Malaria, usually give them anti-malaria. For painkiller, they usually give them steroidal and non-steroidal painkillers. And for bacterial infection, they give them antibiotics. Now, where I'm hitting this is that you see some patient come to the hospital, have a complaint, they are being prescribed some medication with a certain duration on when to take it. Now, for example, the use of antihypertensive and that of drugs meant for diabetes, you are being given 1 week, sometimes 2 weeks, depending, and you are being booked according to when your drug is meant to finish. You are being asked to check your blood pressure, record it, and always report abnormalities if there is, or if there is any side effect or adverse effect you are experiencing in the drugs you are taking. Now, you find out that at the end of the day, you see these patients, we are in a place where you can have a drug refill. You see this patient, after taking the drug, some will not even come at all. Some will still carry the prescription or carry that drug and still go and refill it all by their own, unprescribed, without even the physician's knowledge, without even coming back for appointment. Please, I'm speaking to those who are in this category. If you are this type that has, I went to preach in a church, and I thought about hypertension. That was what I preached that day. At the end of the day, I saw four elderly couple that came and met me that my pikin no see you. I took this drug, the drug got finished. I went again and refilled it. I just thought that, I said, you see, thank God that this message came. This is specifically because of you. You don't refill antihypertensive drugs. This is one of the special conditions. You don't just refill the drugs. You are supposed to go to the hospital once your drug is finished, maintain your medical appointment. And the reason why you go back is you may not even be on those drugs again. Your physician may even change on some drugs, add, remove, or completely place you on diet, and some other drugs that are not supposed to act on the myocardium. So please, if you are a victim of this, please, I have seen a woman during my days in school who was hypertensive. It seems her drugs got finished. She didn't go to the hospital for a refill. She didn't call her physician. She only ordered the drugs. And as all of us went to school, leaving her behind, by the time we came back, we met her dead, lying at just the bathroom. You see, she came out of the bathroom and just sat down, and that was the end of the day for her. So please, don't refill drugs anytime it is finished. No, even if it is paracetamol that is prescribed for you, or Tylenol or Advil, please ensure you go and meet with your doctor at the appointed date he or she has given you. Another scenario is a patient who is diabetic. Because the patient is on a particular insulin, soluble and insoluble insulin, the patient's insulin got finished, the patient still went back and bought the same insulin. You don't really know why you are being placed at that insulin. It may not even be the next insulin you be placed with if you go back and see your doctor at the appointed time scheduled for you. Don't be refilling drugs that can cause your life. You can even fall into hypoglycemia when you refill drugs on your own. You can also fall into hyperglycemia, going to DKA, sorry for my medical term, if you don't adhere to those antibiotic regimen. You can also fall into hypo when you overtake this overdosage of this drug. That's drug abuse. When you don't take it at all, you take it today, in the next 5 days you take it, you can have hypertension crisis. Now, for those of us that, when you come to the hospital, they give them antibiotics. It's most common with, students. By the time the drug finishes, and maybe in some time, the symptom comes back again, they still go back to buy that same drug. So there's something they call antibiotic resistance. See, you can have resistance to that particular drug. You can even have resistance to all multiple antibiotics drug. It becomes difficult for you to have access. It becomes difficult for you to get treated when antibiotics is being prescribed for you. So please, always meet with your physician when you are giving appointed dates. See, you don't even fall into trouble when you refill this drug. See, you are damaging your liver. For those that like to abuse the antihypertensive drugs, especially losartan, all those sedative, you are damaging your kidneys, because all those things has to be excreted out of your system. So it can lead to hypertension, it can lead to so many things. So please, 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 this message is for you. When you are giving drugs and you know that you're on daily drugs, for example, hypertension, diabetes, and not the rest of them, please, when it finishes, go and visit your doctor. And a checkup will be carried out for you. There is a reason to it. And please, when you're given a prescription of a drug, keep them. So even if you feel better, ensure that those dosages are being completed. Don't say, I'm okay, so I don't need the drug again. If you're giving for 5 days, please complete it 5 days. If you're giving for 7 days, please complete it. Don't always have half treatment. By the time you have half treatment, for example, anti-malaria, I see some people, when they are okay, they dump the anti-malaria drug. By the time you come again, that drug may not even work for you. You will have malaria resistance. You become resistant to that particular drug. So please don't be a medical personnel on your own. Always visit the hospital, visit your clinician, visit your physician for more management and proper care to your specific condition. I just hope that this message works good for you and for everyone. And please be your brother's keeper, be your sister's keeper. And as you get this message, please ensure that others are also being educated, that many lives are lost because of drug abuse. God bless you. Thank you.